What's up, yo? Welcome to Your One Life. I'm your host, Kim Young Kim, and I'm super glad to have you as a listener today. If you're new here, here's what this podcast is all about. This podcast is about teaching you from the greatest minds in the world, assisting you in all aspects of your life, and showing you how to save money on lawn care by helping you move every time your yard needs maintenance. Life hacks, baby. Let's go. Now, I'm super excited about this episode because I got to interview the amazing Deepa Halaharvi, who is a breast cancer survivor, a breast cancer surgeon, and a fellow podcaster and the host of the Breast Cancer Podcast. And with October being Breast Cancer Awareness Month, this seems to be the perfect conversation to shine a light on breast cancer awareness and prevention and cancer prevention in general. So here's my conversation with Dr. Deepa Halaharvi. Deepa, how are you doing today? I'm so super happy to have you on the podcast.
Thank you so much, Kim Young. This is exciting. I've listened to a few podcasts of yours, and I'm really excited to be here. Thank you so much for thinking of me.
Yeah, absolutely. My pleasure. My pleasure. I am excited to have you share your knowledge, share your story, and all of the good things. And so what I'm going to do is I'm going to introduce you as I do, and we'll take it from there.
Okay, sounds great.
All right. It was kindergarten year. Let me paint the scene. A child had a vision of a beautiful dream to one day help the hurting with their health made whole. With love as her North Star, she moved towards her goal, but was moved from her home, now a stranger in a strange land. In the short term, this put a wrench in her great plans. With no trust fund found, she started making the rounds and lived out her purpose as an LPN and put herself through college without wealthy friends, then raised up the bar with years more of learning. A physician's assistant was her new role of serving. Still, she kept striving and dared further brilliance and defied all the odds with a husband and children. She enrolled in med school, and through rigor and stress, she became a doctor, the kind Asian parents respect. Then she took her boards and surfed into fellowship and became the best version of herself, a breast surgeon for the health of women she'd be helping along their recovery. When they've heard the words of malignant discovery, but then the news broke. She had breast cancer herself. The doctor became the patient in need of the help that she provided daily. Those were very dark times. But her courage was a light with too bright a shine for cancer to put out, because she showed to be stronger and gave us all hope that we too could conquer. She's walked in their shoes, breathed the air of despair. Now she's changing folks' lives through content and care. With a white coat of hope, she walked by their side. And the light that she carries filled her parents with pride. Their legacy is hers, and she's touched lives forever. And with Dr. Deepa Halaharvi, we shall rise together.
Oh my goodness. Wow. That is amazing. Oh my gosh. Do you have your own album?
No. I have.
That's really very impressive. Very impressive.
Thank you. I'm glad you enjoyed it. Anytime I have someone on my podcast, I am excited, and I have to roll out that red carpet in order to, make them look great. And you don't need much help, because I read your bio and all the stuff you did, and I was like, holy cow, this is absolutely wild, all the things that you've done.
Thank you so much. That's so kind of you. Thank you.
Yeah, indeed.
But you're right. My Asian parents were proud. So, yeah. It's the typical Asian family, right? Like, okay, you go up and you be a doctor. So,
Mm-hmm.
But
no, that's great.
It was also my dream too. So it worked out good.
Yeah. Absolutely.
Yeah.
And I'm just curious, I came to the States when I was I couldn't remember it. I'm so young. What was that like, just being transported to a new country?
Yeah.
Just whole different world that you had not experienced yet.
Yeah, no, it was hard. I mean, as a teenager, so going through your hormonal changes, your friends become such a big part of your life. Mm-hmm. And I left my friends and, started making new friends. Sure. And also, initially, my parents they still like to keep their traditions and values. And, sure. Oh, no, you can't have a boyfriend until you go to college, or, you have, things like that. It was really difficult because everyone dates here. Like when you're 12, 13, 14. So kind of the cultural adjustment was really tough, I would say. But, I got acclimated. Kids, they get acclimated so quickly. So I made friends in high school and we would go to games and things like that. So it was good. It was good.
Okay, wonderful, wonderful. Well, I'm glad that worked out. And y'all, I imagine, landed in Kansas City based on my research?
Initially, Oklahoma.
Oh, okay.
So I went to school in Oklahoma, and then I met my husband in Oklahoma, married, and moved to Wichita, Kansas. So,
amazing.
But medical school in Kansas City, so good memory, yes.
Yeah. Indeed. All right, very good. All right, well, we're here to talk about, all things prevention related since it's Breast Cancer Awareness Month in October. And we're fast forwarding through many chapters of your life, but that's what we're doing.
Yeah. Recently,
I discovered that a number of my friends actually self-diagnose themselves by touching their own necks. How common is that to touch your neck and find something and discover you have cancer?
Depends on what type of cancer. Or do they have neck cancer or lymphoma?
Thyroid, and I can't remember what the other one was.
Okay. Yeah, I mean, if you have enlarged thyroid, that's, sometimes easy to feel. Lymphoma is another diagnosis where it's the cancer of the lymph nodes, and sometimes you can have enlarged lymph nodes. You can also have cancer of the neck, where sometimes it can present with enlarged lymph nodes in the neck. So it's not very common, though, although for breast cancer, it's not uncommon for women to come in where they're feeling masses in their breasts. Yeah.
Right. I definitely want to talk about breast cancer detection and stuff. So is it a good idea to do a lot of self-checking? And if so, like, where do you check and how often, and what are the things that you do?
Yeah. So I think whether you're a guy or a girl, obviously I'm a breast cancer surgeon and I'm talking majority of the time to women, but I also have men who have breast cancer.
Right.
So it doesn't matter your gender, age, even. Like my youngest patient is age 19.
Sure.
So just because you're young, that doesn't mean you don't get cancer. So obviously what I'm focusing on is breast, checking for any lumps, bumps, nipple discharge, lymph nodes underneath the arms, lymph nodes in the neck. In general, people want to pay attention to abdominal pain, bone pain, back pain, headaches. How are your stools? Do you have diarrhea, constipation, that type of thing? Any type of weight loss, headaches, night sweats. Those are all kind of the things that you may think of as something going on in your body. So it's important for people to look at themselves naked in the mirror. I mean, it's your body. You should look at it. Any kind of bumps, lumps, redness is not getting better, not going away. Obviously, take it to your doctor. So.
Okay, that's good. And sometimes WebMD is right, even though it's scary. Is that correct? Is that what you're telling me?
Yes. Yeah. So actually, my patients come after they look at things at Google. So I usually say, now Google did not go to medical school, so don't look at Google. WebMD, I think it depends on what you're looking at. And, I think right now the AI is like, it's great that this AI is there for us to go look at things, but I find inaccurate things, even whatever the AI generates too. So you really have to be careful as to what you're looking. I particularly say if you're thinking of any information pertaining to cancer, things like that, I typically say American Cancer Society, National Cancer Comprehensive Network Guidelines, NCCN guidelines, the ASCO guidelines, National Institute of Health. You just want to go to reputable websites to find information and not just go to Google. One of my pet peeves has been recently, I've diagnosed a number of young women who come in with pretty advanced stage cancer because they are not really taking care of themselves, going to see doctors. They're kind of following this, alternative medicine kind of a thing where the tumor is growing through and they're taking this, the parasite medication, the albendazole, and it's not really proven for breast cancer, but there's a lot of this alternative medicine people that are discouraging women from getting the recommended evidence-based guideline care. And that can be detrimental because then there is a window of opportunity. When you miss that, then you can potentially become metastatic breast cancer or stage 4 breast cancer. Then there's no coming back from that, unfortunately. There is initial stages. We can treat them with surgery and whatever therapies that they need. But if you let it go for too long, then that can be detrimental. So it's important to fact check the websites for sure. Yeah.
Right. And I heard, you probably heard about the story about the woman who her mom was telling her based on like an influencer or something along those lines that she shouldn't receive care. And then she ended up passing away because she was doing something else that was not recommended by the medical professionals.
It's very disheartening as to how many people claim to be professionals or experts, not professional experts online in like TikTok and Instagram and things like that. And you really have to be careful. You have to check their credentials. Are they board certified doctors? Did they go to medical school? Did they get training? What are they benefiting from this? Are they selling something? Are they trying to benefit monetarily? So you have to check that. No juices, cleansing diets, things like that is going to take care of cancer. In America, of all countries, it saddens me to see that because we have such good care. But you really, with any type of cancer, you want to be diagnosed early stage, good prognosis, and good survival. And so if something sounds too good to be true, it probably is.
Yeah.
So you have to be,
Yeah. And in that vein, there are a lot of doctors on YouTube, like a lot of doctors on YouTube. And I don't know how to check their credentials except like the ones that I've watched, I'm like, I think you're legit. And you talk a lot about stuff that sounds like you know what you're talking about. But like, how would you know that, Dr. Cornelius or whoever it is legit and not some guy in his parents' basement?
Yeah. You can check them out. Like you can go to, we get licensing from from Ohio. I have licensing for what I do. And you can go to the medical licensure board to check out the credentials of the doctors. And also if you type up my name, it goes into the institution where I work. And there are these ratings and comments from patients for over
highly
the last
rated,
5-6
by the
years.
way, Dr. Halaharvi.
Thank you. Yeah, thank you so much. So, those are some clues. And, you can always call the hospital system.
Sure.
I just say, don't take something, at their face value. Make sure you check them. And it's okay to disagree. But it's interesting. The other day, I had a young patient and the husband came. So I work in Ohio. We have different competing hospitals here. The husband, Frank, just came and said to me, why shouldn't I go to this other hospital system? Why should I come to you? Like, what is it that you're giving us? So my resident was with me and she said, you were so calm and you're so composed. And it's okay. That's fine that he's asking that question. It's always okay for patients to get second opinion at a different place. And I just kind of told him, this is run-of-the-mill cancer. This is the cancer we take care of. I treat so many cancers. I do about 500 surgeries a year. You're totally fine to go get a second opinion, totally fine to get their opinion. But this is how we treat it. This is our algorithm. And we present our cases at the tumor board conferences. That's another thing too with cancer. Most hospitals have a multidisciplinary conference where you present your cases in the front of tumor board with other surgeons, medical oncologists, radiation oncologists. And those are the type of institutions that you need to be. There's also Cancer on Commission, like that's a accrediting body. There's NAPBC is another accrediting body. You can look up the doctor and also the institution where they work to make sure everything checks out.
Okay. Good to know. I will cross-reference every YouTuber and that we're going to take them down together if they're faking it.
That's right. Well, that's part of the reason actually I came up with my own podcast, during COVID, is because there was so much misinformation out there. Every Tom, Dick, and Harry is like, come on board and be like, I'm expert in this or that. I just wanted evidence-based information for my patients in a platform, not thinking that this is going to be so well received, not just across the country, but outside the country, just because the expert knowledge and information is not really there.
Yeah. No, it's great. And it's a very important work. I've listened to multiple episodes of your podcast. So here we are.
Oh, that's good.
Yeah, helping each other with our stats. Now, I wanted to learn. I was just like, that seems interesting. So on and so forth.
If there's anything better I can do, let me know.
No.
You're a great podcaster yourself. So
No, it was great. It was riveting information. So Okay, so in regards to whether you have had cancer before or whether you've never had cancer, what do you recommend people do? Obviously, eat fruits and vegetables, don't smoke cigarettes. I learned through your podcast that alcohol is really bad for the most part.
Right, yeah.
So we know we got to exercise. Besides the general good information, what really, I guess you get a lot of bang for your buck practicing good health habits?
I say 5 things for my patients, and this is for anyone, whether you've had cancer or you've not had cancer, it decreases the risk of recurrence. So obviously exercise. What type of exercise? Well, there is the aerobic exercise and there is the strength training. There is so much data that's now coming up, especially for women. And I'm pretty sure it's probably the same for men too, but especially for women in my field, we take these young women, put them in menopause because of cancer. We remove their ovaries. So at young 20, 30, 40-year-olds are becoming postmenopausal. that causes a lot of dysfunction in their body. So strength training, and we usually say muscle is an organ of longevity. Like you have to like protect it and train it like your life depends on it, but it truly does. So strength training 2-3 times a week, lifting heavy weights, some sort of cardio, walking, running, things like that. Obviously limiting alcohol, no more than 2 drinks per week is what I say. Now, having said that, I have a hard time completely eliminating alcohol because I love my social connections, my friends when we get together. So I'll have a glass of wine here and there. And then sleep is paramount and it's very important. And we're getting more and more data now about sleep, 7 to 8 hours of sleep. And also going out in the morning when the sun comes out, the circadian rhythm, it sets where you're able to fall asleep at night. No smoking, HPV, like there is Cancer Atlas that looks at cancer globally. It's a 4th Cancer Atlas. American Cancer Society talks about that. And we have about 16 million cancers worldwide and 10 million deaths worldwide of cancer, different cancers. Mm-hmm. So 50% are modifiable risk factors, meaning things we can do to improve and change. And other 50% is non-modifiable risk factors. So it's your gender, your family history, your genetic makeup, all of those is non-modifiable. You cannot change that. But things you can change is 50%. So limiting alcohol consumption, not smoking, limiting UV exposure, and then also getting vaccination for HPV because that can cause head and neck cancers, then anal cancers and cervical cancers. And then, so I talked about exercise. I talked about obviously eating healthy. Exercise not only includes the aerobic, the strength training, but also mindfulness meditation is what I say. And then eating healthy, sleep 7 to 8 hours. When you're sleeping, your body, your neuroplasticity, and you're kind of eliminating all this junk in your brain, you're recycling. It helps you to retain information the next day, helps sort the memories, kind of synthesize your memories. Social connections, we are learning during COVID, the people who did not go out and have social connections. My mom is one of them, unfortunately. She became too comfortable being at home by herself and not being out with her friends. 25% risk of dying because you do not have good social interactions and connections. It's because of heart disease. It's a direct link to social isolation, to cardiac disease, 25% mortality or death rate. And then the other thing people can do is increase or just follow screening guidelines. Mammograms. If you're average risk woman, you need a mammogram starting at age 40 every year. Do your monthly breast exams. Between 25 to 40 years old, they need to be seen by a clinician every 3 years. Do the breast exams. I see a number of young women. 15% of the young women get diagnosed under age 40. And so they need to be able to do a breast exam once a month. And if they find any masses, lumps, enlarged lymph nodes, nipple discharge, they need to be seen by a doctor. Colon cancer. Age is now decreased to age 45, so people need to be following and getting colonoscopies and things like that. Weight loss, abdominal pain, bone pain, back pain, like we talked about. Like screenings are so important. Making sure that you're seeing your clinician once a year is important. So, Sorry, that's a long answer to your short question.
No, it's fine. It's fine. Let's see how much of that I can remember, actually. Let me do a little something with that. Well, you gotta come through and get exercise. You could lift a bunch of weights and arrive. I'm talking about sleep. You gotta just be deep. You gotta understand that it is how you rise. You could understand the diet is so good. And the alcohol is not something you should do. I'm talking about them screenings, something that I'm seeing. I need to see my doctor every 3 years. I'm sure I missed something there.
No, that's really great. Also we talk about cancer this month because of it being Breast Cancer Awareness Month, but the number one cause of death for women is heart disease. And so we still have to take care of our hearts. And it's not the breast cancer. Breast cancer, if you get diagnosed in early stages, there's good treatment, good prognosis, and good survival.
Yeah.
So, but going back to the strength training part, I'm very passionate about that because really the organs that it's helping is your brain. You release BDNF, brain-derived neurotrophic factor. It helps your heart with decreasing blood pressure, vasodilation for the blood vessels. It helps with the bone, not getting osteoporosis as we get older. Cancer patients are very prone to that because of the medications we use to treat them. Also, it releases GLUT4 in the muscle, which actually pushes the glucose into the cells, so decreases insulin resistance. So there's a number of benefits from strength training. So And we're finding out more and more as the time goes on.
So you're telling me to stop making fun of the meatheads at the gym?
Yes.
Okay. I just want to be one of them. So here we are.
I know. Same. Yeah. I go to workout. I go to the gym, sort of the CrossFitish workout, because I'm trying to be one of them. But yeah.
No, that's wonderful. I did not know. I knew it was, you hear about things, but you're just like, all this stuff you just listed. I'm just like, you know what? I'm going to walk around with dumbbells everywhere now.
I know.
That's great.
I walk with a weighted vest. Hopefully, that's doing something good for me.
Yeah, most definitely. That's great.
Yeah.
And so you had mentioned screenings. At the age of 40, women need to start. But you said from 25 to 40, they need to see a doctor every 3 years?
They need to see every 3 years or so just for an exam. So a clinician will do an exam, but they need to examine themselves at least once a month. And if anything, for premenopausal women, meaning women who are still having periods, they need to check their breast once a month, a week after their periods. And again, checking for any masses that feel like a rock or a marble. The breast starts at the collarbone. It goes all the way to the bra, below the, what we call inframammary fold or the bra line. And enlarged lymph nodes underneath the arm, redness, puckering, pulling of the skin, pulling of the nipple, bloody nipple discharge or clear nipple discharge, any of that. A lot of these young women, the only way to get diagnosed is breast exam because the screenings don't start till age 40. Now, if you have family history of breast cancer, you start 10 years younger than your family member who was diagnosed with breast cancer.
Oh, okay.
So,
that's good to know.
Yeah, so that changes if you have family history, right?
Right. And so in regards to self-diagnosis and checking yourself once a month. So a previous guest of mine, Shantae Lowe, 35-year-old, 4-time Olympic high jumper, the specimen of health. She was examining herself one month and she found a tumor the size of a grain of rice. And she went to her doctor, and her doctor, who was a man, said, "You are too young and too fit to be getting breast cancer." And she was, I want to say 34, 35, something around there. Yeah. And so she listened, because that's what you're supposed to do with doctors, right? I guess. Yeah. And she didn't go get a second opinion. And then a year later, it gotten worse. She had to go get a double mastectomy, the whole nine. So in regards to interacting with doctors, in regards to the healthcare companies that never want to pay for anything, how do you fight back against them? Because they're the experts. They also have a lot of the power. And then you're just this person who's just a number sometimes, unfortunately, in their eyes. Not that we're just numbers, but yeah.
Yeah, no, I hear this for patients coming from different institutions and things like that. My first tenet that I teach my residents and fellows is our job is to prove that they don't have cancer. So whether it's getting screening mammogram, ultrasound, a biopsy, I need to know a pathology report that tells me it's not cancer. And so majority of the time I do that because I have a lot of young patients. For some reason, I have a lot of young patients between 20 and 40. So what are some things you can do? So in her case, and I was actually, by the way, I know you sent me her information and I was checking her out. She seems incredible. I have patients who come in who are very healthy, work out, and you just picture of health and you just never think, oh my gosh, cancer. But cancer can happen to all these things that I mentioned that decreases the risk of developing cancer. It never 100% prevents cancer, right? As long as we are living, we are exposed to toxins, we're exposed to environmental, stuff that we don't have control over, the things we're ingesting, the stress. There's so much that goes on in our lives that is outside our control. So cancer can still happen. Unfortunately, if she was diagnosed, I don't know her whole story, but if your cancer is diagnosed when it's size of a rice grain, your prognosis is near 100% survival. Smaller surgeries, less invasive therapies, things like that. What can people do? Well, number one, know your rights. You have rights. You can question your doctor. Your doctor is not God, as what they used to say in the past. You do not want to go to a doctor who paternalistically telling you this is what you should do. I hate that. Personally, I hate that. I just want someone to give me the knowledge and the explanation and then help me make the decision. So you want the doctor who gives you the knowledge and information to help you make the decision. If you want the doctor to make the decision for you, that's another thing. But know your rights. It's always okay to get a second opinion. I sometimes will have patients say, this other doctor didn't like it when I brought up second opinion. Well, you know what? That doctor is not the right doctor for you. And you always have to listen to yourself, listen to your gut, listen to your intuition. Ask for transparent billing. Let me see the billing. Where was this charged and why was this charged? And then full explanation of treatment options. What are my options? Number 1, number 2, number 3. And what do I do next? What are my next steps? always keep copies of your results and your imaging. You always want your questions to be well understood. Like, you want to understand your questions. If that doctor is not explaining well enough or not taking the time, go to another doctor. There's plenty of doctors out there, and if you feel dismissed, if you feel microaggressions, prejudice, whatever, whatnot, it happens, go to a different doctor, because it's always okay. And a doctor is not, God by any means. Know that you have rights.
Right. So first thing I do when I walk in to say, "You're not God."
Yes.
Okay.
No, say it. I mean, we all need, humble pie, right? So as surgeons, especially, we think we are gods and we are not. So every single day I get humbled with something that happens, but I think it keeps me humble and grounded, which is good.
No, that's where we want all of our surgeons to be. So absolutely.
Yeah.
Absolutely. And you just talked about toxins, environmental toxins and whatnot. We live in the United States of America. They don't have a lot of regulations, unfortunately. Like our chicken can't be sold in Europe. Is that right? There's like the food that we eat, so on and so forth. And so how do we combat these toxins? What toxins should we be aware of? Obviously, there's things that we know of, but then there's things that are just like hidden. My brother tells me all the time, he's like, that has something to He is like the most don't put that in your body person I know. And I appreciate it.
Yeah, my brothers are like that too. My younger brother especially. He's very big on like making sure you're not putting the wrong things in your body. But unfortunately though, I mean, obviously the very knowns, the tobacco, the vaping, I think that's bad. The BPA plastics. I mean, how do you avoid a bottled water? Like, how do you avoid this? Like, I'm at work, I'm thirsty, and I do take my water bottle, but it's like I'll have my laptop bag, I have my other bag, I have my lunch bag. And so how do you avoid this? But BPA in the plastic bottles, pesticides, harsh chemicals, processed meats, canned food, excessive alcohol. For women who are perimenopausal age, hormone replacement therapy is not always the answer. It may be answer for some people, not always the answer. So those small choices can add up, and you just have to make sure. Air pollution, you can't control it. UV light, maybe you can control that. Radon gas, asbestos, secondhand smoke, maybe you can control it. Industrial chemicals, maybe you can control it. I think some things you can control, some things you can't. But those are all some things to think about. No
canned foods? Oh, no.
Yeah, I think limited, in moderation, limited. It's hard. I know. I just made a chicken chili this weekend and I used organic canned beans, but I don't do that often. So, it's the process to soak your beans and cook it and all that kind of stuff. So,
right. Yeah.
Yeah, there is a lot of things. I think the healthiest thing is if you just stay with clean, fresh fruits and vegetables and meat that doesn't have too many like pesticides and chemicals and hormones and things like that. And just focusing on what we call Mediterranean diet, which is nuts and legumes and fish and chicken and olives and olive oil and, limiting butter and limiting sweets and sugars, things like that. So the best is if you can cook food at home. And that's kind of what I try to teach my kids. And growing up, right, in Indian family, my mom cooked every meal at home. And I would always think, gosh, my friends are always going out to eat. Why can't we go out to eat? And I was so upset, like we cannot go out to eat. Of course, we were poor. We can't go out to eat at that time. But now it's like looking back, what I would do for that home cooked meal, every meal, because that's supposed to be healthy for you because you're making it yourself. So
No, that's great. That's great.
Yeah.
Okay. So you said something about meat with toxins in it. So is buying organic important? Like, what should I look for? I felt like all the meat had toxins in it. Obviously, organic doesn't as much, right? Or whatever it is.
I think so. I mean, I'm probably not the expert on that, but trying to stick to those organic type of meats where it tells you that it's raised without any pesticides, any hormones, things like that, I think maybe potentially helpful. Maybe, majority of the food coming from like plant-based diet is probably also a safe thing. So that's what like limiting meat to maybe once or twice a week and not like every single day kind of a thing. And then just calories in general, just a lot of fiber and protein. If you have a lot more of that too, I think is important.
Okay. So you just said two things. You said limiting meat to 1 to 2 times a week and then eating protein.
Fiber and protein.
Which I just feel like...
You can get it. I know. I mean, I find it hard too to get protein without the meat products, but there is a lot of legumes and lots of vegetables that you can get protein from. It's just that it takes time to figure out, what is what. And I mean, you can make a ton of soups and things like that with adding a lot of legumes and beans and vegetables that can, give you that fiber and protein that you're looking for. So,
Okay. I will do my best. All right. So we have a situation of there is a lot of genetic factors to cancer. Obviously, it's not a one-to-one correlation, and one of your parents had it, so you'll automatically get it. But I've heard from the research, and I've also just heard from anecdotal stories, a lot of that runs in the family, unfortunately. I guess what family history is important, because if, let's say, an aunt or a second cousin, or who should you really be mindful of? Obviously, your parents.
Yeah.
And is it more so one side than the other, or is it?
That's a really good question. I think it's something that we really need to talk about. So when we're thinking about genetics, family history, we're really very interested in the first degree relatives and the second degree relatives. So first degree relatives is someone like your parents, your siblings, your kids are first degree. And the second degree would be your maternal aunt, your paternal aunt. And your grandparent would be second degree, your grandparents. That's your mom's mom or dad's mom, that's second degree. Now, people like your great-grandmother is a third degree. We don't really care so much about them. I mean, we still care, but the first and the second degree. Things that we're looking for. So you get DNA, 50% from your dad, 50% from your mom. You can get diseases from either side. So if you have a family history of breast cancer, ovarian cancer, pancreatic cancer, prostate cancer, melanoma, uterine cancer, brain cancer, thyroid cancer, you really need to talk about it amongst each other. Back in the day, you had to meet certain criteria for genetic testing because there's mutations like BRCA or BRCA1 and 2, CHEK2 mutation, PALB2, Lynch syndrome, which is associated with colon cancer. Back in the day, you had to have so many cancers to get tested for the genetic mutations. But anymore, there's so many genetic companies out there that are performing testing for a couple of $100s. So if you talk to your physician, they can refer you and basically a blood draw for you to get tested. There's typically in our health institution, there's genetic counselor who will counsel you as to what the genetic mutations mean, if you need to get screened closer. For instance, if you have a BRCA1 mutation, your risk of getting breast cancer is up to 70 to 80%. Risk of getting ovarian cancer is 40%. There's risk of melanoma, prostate cancer, pancreatic cancer. So you would be followed closely, not just with the skin checks, but also checking your ovaries, checking pancreas. If you're a male, checking for prostate cancer. So you will be followed more closely. So it just gives you information. So knowledge is power. Then you can make those decisions for close monitoring and close screening. And again, with cancer, if you're going to get cancer and be diagnosed with cancer, you want to be diagnosed early stage, good prognosis, and good survival. And you are the CEO of your own health, and you want to advocate for yourself.
Right. Absolutely. And in regards to just going back to the first degree versus second degree, how, I guess, important is first degree compared to second degree? I don't know if I'm getting too technical right now, but it seems like first degree would make a big difference and second degree would make some, but not as much. I don't know.
Yeah. So if you have early onset breast cancer, say your maternal aunt got diagnosed with early onset breast cancer, meaning premenopausal breast cancer, you would qualify for genetic testing. Now, I had breast cancer. My genetic testing is negative. I don't have a mutation, but my daughter is still at risk for getting breast cancer. Her risk is increased because of me, because of having family history. Even though I don't have a genetic mutation, she probably doesn't have a genetic mutation. My niece is probably still at high risk, but not as high risk as my daughter is. So the risk kind of goes down the further you go away from the tree. If you think of a family tree, I'm here, my kids are here, and then my brothers are here, they're first degree relatives, my nieces and nephews are, a little further removed. So the risk gets not as high. Now, it really depends on early onset cancers in the family. How many do you have? Is there a male breast cancer? It's not very common to get male breast cancer. 1% of all cancers are male breast cancer. So if you have a male breast cancer, there's a likelihood that there's a genetic mutation, and that usually goes with the BRCA2 mutation. So then you want to talk to your clinician to see if you're qualified for getting genetic testing.
And you said companies do it for a couple $100 or whatever it is.
Yeah, I mean, in Ohio, we do. I'm sure it's probably the same across, because there are so many genetic mutations we don't know yet. And so what is a genetic mutation? It's a DNA suppressor gene. So its whole goal of, say, BRCA, BRCA, it's a DNA suppressor gene. So its whole goal is to suppress tumors from forming. It's a tumor suppressor gene. Its goal is if tumor is dividing, it needs to stop it from keep dividing. That's its goal. That's its role. But if there is a mutation, meaning there's a damage in that DNA, it's not doing its job. So the tumor starts multiplying and replicating. What is the purpose of finding out that you have a mutation? Well, I can take the control in my hands, and maybe I could consider prophylactic mastectomies, or I could get close screening with the mammogram and MRIs. I could have a close follow-up on my ovaries and uterus and pancreas and other things like that. So it gives you the power to make those decisions for yourself. And genetic counselor is a good person to kind of talk to you about what kind of genetic mutations that could potentially be there in your family based on your family history.
Okay. I imagine this isn't covered by insurance.
So if you have family history, it is typically covered by insurance.
Right.
But if you don't have family history and you still want to find out, and like I said, it's become pretty inexpensive these days, depending on the genetic companies. If you're interested in it, you can reach out to genetic companies, and I'm sure they can, for a couple of $100 here in Ohio, they do cover it. So the other important thing talking about this, I want to say is I come from an Asian background where no one talks about family history. So soon after I was diagnosed, I was on the Today Show, and I told my mom, I'm going to go on the Today Show to talk with Hoda. I'm going to be talking about my cancer. And she was like, oh my gosh, you're going to go on national TV and tell people that you have cancer. And I'm like, Mom, I didn't rob a bank. I had cancer. So,
I mean, that would have been cool. No, I'm just kidding.
I know. I mean, so that is a mindset that my mom had, is like, she thought it's some sort of taboo to talk about cancer. But I think that is the most important thing you have to do is when we get together as families is talk to each other about what's going on in the family so other person can advocate for themselves.
Yeah. And that's actually really good. And that makes me think, maybe I'll have a fake wedding so that I can talk to all my family members about family history, perhaps.
Hopefully, you'll invite me to the fake wedding since I was on your podcast. Yeah,
exactly. Yeah, we'll make content while you're there. It'll be glorious.
There you go.
Yeah, it's perfect. Good deal. Okay, so this is all great information, and I'm super happy to put it out there. In regards to, we talked a lot about just prevention, looking out for yourself, genetic testing and whatnot. More than likely, we will know somebody who probably is going to be fighting cancer in the next couple of years in our circle. As someone who's gone through it yourself, what are some just pieces of advice that you can give people to be helpful to the people that they're trying to support? It's rough, as you know. I
think for us women, we struggle with asking for help. A lot of women are not good at that. Some men are not good at that also. I think listening without judgment, listening to whatever they're saying, how many ever times they have to go through the story over and over again, listening without judgment. I think the other important thing is not saying, so-and-so did this, you should do this, or giving examples of other people that didn't end well. That's not helpful either.
Yeah.
That has happened to me.
Oh my gosh.
But, like practical help, making meals. Don't ask them. Maybe just say, hey, I'm going to get this meal for you. Would this meal be okay? Instead of asking, or just setting up a meal train, helping with childcare, taking care of the kids, going and cleaning the homes, offering a meal, just kind of figuring out what that person needs. I think the one thing they do not need is toxic positivity, like, this too shall pass, things like that, like we tend to say without thinking about it, or I know how you feel. No, you don't know how they feel. You're not in their shoes, So those type of things. I think just being present, being non-judgmental, being there, listening, offering help wherever they can. And also one of the most important things as a survivor, once your treatment ends, your whole medical community is gone. Your doctors are gone. They send you back to this world. Now you're there to take care of yourself in this world. Well, that is called survivorship. That's when your life begins. And it's a whole lifetime of journey. It's filled with fatigue. It's fear of recurrence. It's hot flashes. It's night sweats. So you're worried the cancer comes back, any kind of ache and pain. So to be there with that person, to help them, whether taking them to the doctor or, things like that, I think it's important because people do feel lonely once that cancer treatment ends.
Sure.
But in general, I think just being there in their lives without judgment. And sometimes people will say, they may say, just leave me alone, and that's okay, and don't take it personally. So
Sure. Okay. All right, let me do something with that. All right. Okay. Yo, you're a friend on a mission. You just got to listen. I'm talking about the things that you got to do. Don't give them toxic positivity. You just got to be given free a whole bunch of your love and a whole bunch of meal trains. Yo, it's just insane how you could just show up and just clean up and do a bunch of things. And you could just bring them with something without even asking. And that's what I'm saying. I'm just tasking you to understand that after it's done, you could still come through and you could just run them to the doctor and come straight through with a whole bunch of things that you bring a whole bunch of love for your people. And that's what I'm saying. There's no equal to a good friend in hard times. And that's what I'm saying. That's my line. I spit off the top and that's how I go. Dr. Halaharvi, up in the flow. All right.
Oh my gosh, you're amazing.
I try to have fun.
Did you do this all like growing up? Like, how did you know that you can rap? Like, how did you know that?
Well, I started when I was actually like a junior in high school. I just started very poorly, like most people do with most things. And just, kept working on it. And I lifted weights and ate legumes, and no, I'm just kidding. Sorry, but I just you just keep doing it, and then you get better over time. Yeah. Oh my gosh. Okay, so this has been a great conversation. I do have a question that I'm starting to ask all my guests now, which is, who is someone that you recommend that people need to learn from that they may not know about? So whether it's an author, someone who has made an impact on your life through their works, someone that we can all access. Like, I'm sure family members of yours are great. And I know that you've written a book about your parents, which is beautiful. Which I guess we can learn about from your parents from that book. So I will make sure to tie that in the show notes and tell people about it.
My all-time favorite book is Viktor Frankl, A Man's Search for Meaning. And I recommend that to people. And I've read that at different phases of my life, good and bad and adversities. And it's a good pick-me-up. And I just started reading yesterday, Theo of Golden. Have you heard of that?
No.
Theo of Golden.
Theo of Golden.
It has really good ratings. And so I'm going to probably have to let you know what I think of it once I read it. But I mean, my friend gave it and she said she is a big reader. And she said this is one of the best books that she has ever read. And she reads all the time.
Okay, wonderful. Theo of Golden and Viktor Frankl.
Yes.
Wonderful. And one last thing. I know that from my research, you shared that your father taught you to do your best and live with excellence and have big dreams and have kids and then go to med school, which putting all of us to shame. But what's something that is maybe something he taught you that you feel like people need to hear more of?
I think it's really like going back to the basics of like the hard work ethic and the honesty and to be a person of integrity, like, what you say you're going to do it, and keeping your word, things like that. Like, I feel like that's kind of declining these days, like especially people coming in late to work, leaving early, or being on their phone and not paying attention. He always said, whatever is in front of you, always do the best you can. So whatever the task that's in front of you, give it your 100% and do the best you can. For me, that has helped me instead of looking 10 years ahead. Like, this is the task right in front of me. Like right now, it's the podcast. I'm doing a podcast with you. I want to do the best I can with this podcast, my knowledge that I want to share. And then after I'm done here, I'll do whatever the next thing is. But that has really served me well. And if anything, there's a secret to success. I just like doing the best that's right in front of you, then puts you at a better step for the next thing that's coming up,
Yeah, absolutely. No, that's wonderful advice. And I love that. And what was the quote I saw? It was like, don't worry about anything. Just focus on the next 10 minutes of your life and what. And I'm just like, oh, that's good. The next 10 minutes. I like that.
Yeah.
Good deal. Deal.
This has been really great conversation. You're a really great host. And thank you so much for having me. It means a lot. So I can't wait to listen to this.
Thank you for your kind words. I do appreciate just you in your very busy schedule of coming from the people don't know, but the reason why you're wearing your work garb is because you came from the OR. And and here we are. I feel like I've been operated on myself.
You're sweet.
Yeah, that's great. Okay, so first, how can the people find you online? The best ways?
Yeah, I mean, if they just look me up, drdeepahalaharvi.com, I have a website. My podcast is called the Breast Cancer Podcast. And that's an easy way to look. And just one other plug-in thing I may say, if you will, is I'm hosting a survivorship event. I opened a nonprofit in my parents' name. It's called Asian Savvy Foundation for education for the underserved people. And I'm also hosting an educational event for survivors coming up on November 15th in Columbus, Ohio. So we're going to have 2 hours of education on mental health, sexual health, surgery, complications of radiation, surgery, screenings after cancer. Then we're going to end it with a fun fashion show of the survivors. So I have male breast cancer survivors, young people who are diagnosed, old people, different ethnicities, and all that stuff. So I'm really excited about that. So, and they can find that out if they type my name. It's called We Rise Together is the name of the event. And so if they type that up, they can find more information on that.
Yeah, absolutely. All the links, I will make sure to put them in the show notes. And then you're on TikTok too, so I'll plug that.
Yeah.
And then all your other links. Fantastic. Okay, cool. Well, I thank you for your time. And yeah, this is, I'm excited.
Thank you so much, Kim Young, for having me.
Yeah, thanks for being on the podcast. And I hope you have a great rest of your day and a great week. And we will show you as the star you are very soon.
Oh, thank you so much.
All right, so that's the episode. I hope you enjoyed it, and I hope you apply all of these important learnings to your own life. If you're new here, don't forget to hit the follow button so you don't miss future episodes. And if you enjoyed this episode, my only request from you is for you to send this episode to a friend that you think will benefit from it, or to share it to your stories wherever you hang out online. Shout out to my dude Siraj Rhett, who made the instrumental for this podcast. And shout out to Ted Cragg, who edited this episode. And again, a big thank you to the amazing Dr. Deepa Halaharvi for being a guest on this podcast and for all the amazing work that she does in this world. All right, so that's all I got for now. This is Your One Life. I'm Kim Young Kim, and I hope you have a great day, a great week, and until next time, peace!